Good afternoon and welcome, everybody. My name is David Nelson, and I'm here to welcome you to our second Community and Clinical Solutions to Lead to Lead. Leaducation, a focus on dust, soil, and paint. We are thankful for our partners that are a part of this project. And I want to remind people that if they have comments, they can enter them into the chat. But at this time, I want to introduce my friend and colleague, Dr. John Moyer. Dr. John Moyer, MD, MBA, is a professor of community health and pediatrics and director of the Institute for Health and Equity at the Medical College of Wisconsin. He is co-investigator of this academic, clinical, and community partnership to reduce lead poisoning with the support of the Medical College of Wisconsin and the Advancing a Healthier Wisconsin Endowment. Dr. Moyer, I turn it over to you, sir.
Thank you, Dr. Nelson. It's a joy to join you and colleagues to share with our community. And good afternoon and welcome to the second part of our virtual webinar series exploring the complexity that Milwaukee faces regarding lead exposure testing and solutions. On March 16, we focused on lead in water. Today, we'll focus on lead in paint, dust, and soil and preventive responses. This series is co-hosted by the Medical College of Wisconsin Office of Community Engagement and the Clinical and Community Solutions for Lead-Free Children project that's funded by the MCW Advancing a Healthier Wisconsin Endowment and led by Dr. David Nelson. First, Ophelia Mondragon with SDC and Michael Mannon of the City of Milwaukee Health Department will review the challenges. Second, Maria Beltran, a member of the Coalition on Lead Emergencies, COLE, will provide a community perspective on the problem. And third, a panel facilitated by David Nelson, who's with our Medical College of Wisconsin Department of Family and Community Medicine, will discuss policy approaches to reduce lead risks. And the 7 panelists include Ophelia with FDC, Richard Diaz of COLE, Brian Weaver with Wisconsin Department of Health Services, Mike with the Health Department, Jamie Fershinger with 16th Street Community Health Center, Anastasia Brennan with Children's Wisconsin, and Frank Cumberbatch with Bader Philanthropies. Now, Ophelia and Mike will unmute and provide more information for you.
By the end of this presentation, I hope to increase your understanding of lead poisoning. We're going to talk about in Wisconsin, and also we're going to cover information for the city of Milwaukee, and also to understand the main sources of lead poisoning. Next. First, lead is a naturally occurring bluish gray metal found in a small amounts in the Earth's crust. Lead is a soft, malleable, and corrosion-resistant material. Once lead is used in a product, it's nearly impossible to identify it with the naked eye. Lead does not biodegrade or disappear from the environment over time. And much of our exposure comes from human activities involving the past use of leaded gasoline, some types of industrial facilities, mining and manufacturing, leaded aviation fuel, and past use of lead-based paint in homes. Lead has also been found in a wide variety of products found in and around our homes, including paint, toys, plumbing materials, and some ammunition and fishing tackle. Next. So pretty much I just wanted to go over a little bit of history. For many of us, this is just kind of a quick refresher, but then some of us, this may be new information. So pretty much in the United States, federal regulations were passed to ban lead in the most common sources because it was a potent environmental toxin, especially for young children. In 1978, lead was banned from residential paint using on the inside and outside of our homes. 40 years later, federal rules were enacted to regulate renovation work taking place in homes built before 1978 in order to protect children from that lead paint being disturbed in the process. Wisconsin was the first state to gain the approval. Starting in the mid-1970s, the US began to phase out lead from gasoline. Just recently, the use of leaded gasoline ended worldwide, with the last country eliminating its availability. Lead is still in airplane fuel used for piston engine planes, which are common aircrafts in smaller regional airports and with hobbyists. And then also it can be found in gasoline for race cars in Wisconsin. In 1986, the Safe Drinking Water Act was amended so that all pipes, fixtures, and solder installed in homes and city water utilities were lead-free. The US is still dealing with the repercussions of this legacy of lead in our environment, especially in older homes and drinking water service lines. Next, please. Lead is particularly dangerous to young children under the age of 6 because their growing bodies absorb more lead than adults, and their developing brains and nervous systems are more sensitive to lead damaging effects. The hand-to-mouth behavior in young children increases the risk of lead exposure through dust and paint, and this behavior is especially prevalent between ages 9 to 20 months old. Lead-based paint has been confirmed to be the most common source of exposure in a child's environment. Next. I just wanted to highlight some maps. This is a map from the state of Wisconsin, has consistently reported some of the highest numbers of lead poisoned children in the nation. As you can see, the red dots, those are kids with lead poisoning. Next. And then this is just to highlight 5.6% of children who were tested for lead had a blood lead level greater than or equal to 3.5 micrograms per deciliter. So we still see a high volume of kids being tested and testing positive for lead. Next. So I just covered, the problem at the state level. This is definitely not a local, an individual home. We do have concerns not only at the city level, county level, but statewide level. Michael Mannon is going to give us more detailed information for the city of Milwaukee. But to just highlight, as you can see, I wanted to highlight this bar. This is the city of Milwaukee. So by far, the city of Milwaukee has the highest rates of childhood lead poisoning, but lead poisoning is occurring in every part of the Wisconsin area. Mike?
Yeah, if we go to the next slide, I think to dovetail onto what Ophelia is saying, I try to give you the problem and scale in the city of Milwaukee here. Just based on the numbers, here's a comparison from 2018 to 2022. 2018 is a pretty good year that we have pre-COVID. And of course, 2019, 2020, and 2021 were our COVID years. And then 2022 is our most recent data from last year that we have. And we're kind of looking at it in two ways. One is from the case management side, and the other one's from the property side. So I've got two slides. This one here is on the case management side. And there's a couple of mantras that we could see. We can clearly see that some of the trends of, we had a programmatic cleanup in 2018 and 2019. So that kind of would explain some of the anomalies that you see in the data. Specifically, you can look at the first row, the number of EBL outreach letters sent, and you can see between 2018 and 2019, there's a lot more. Between 2019 and 2020, a big chunk of the programmatic cleanup got done. And then we did some improvements on the case management side, which I'll get to a little bit later. But 2020 was that year where we had quite a bit of COVID shutdown. And so I think a few things to take away from this slide, from what we have a short amount to cover in time, is that the number of children, the second row, that are referred for nurse case management, those are new cases on top of the existing caseloads that they have. So you get an idea of the volume of work that every public health nurse has to do here. And we're kind of achieving pre-COVID levels with the amount of work that's being done. And that would make sense because of all of the children that didn't go into hospital systems to get screened over the COVID year. And if you think about it, they're kind of stuck in an environment that's hazardous. So we really have to get more of them screened. Some of the other things that we can see on there that I really want to spend time talking about is the second row to the bottom, the number of case management outreach interventions. And you can see that a significant increase in data and nurse interactions. And those interventions are everything from phone calls to lead risk assessors, phone calls to hospital systems, phone calls to the families, and then the home case management visits, which would also include telephone visits that were happening during that time period. So one of the trends that we can see is even though we had COVID, we never shut down. We still, in fact, increased the workload that we were doing with our nurses between 2019 to 2022. If we go to the next slide. And this is the lead hazard reduction data. And again, we see some of the same kind of trends that are there. This is all on the property side. And again, we're kind of, rebounding back through the pandemic and kind of starting to reach back to the 2018 pre-COVID levels that we were at. Just on some background onto what we do in the health department. So we're statutorily required to go after anything greater than 15 micrograms per deciliter. So that gets the full education, case management, and a home property inspection by a lead risk assessor. Subsequently, the orders are issued, a lead inspection assessment report is created, permits and abatement is the end goal in those cases. What we've done in addition to that is we only go out on the first lead level test. So we don't need the two that we do. So we're a little bit ahead of what the state requires. And then some of the ARPA funding that we've received, the 25 million in American Rescue Plan funding, allows us to go for those 10 to 14.9 micrograms per deciliter. So we're trying to intervene at earlier lead poisoning elevations to prevent that child getting poisoned at the higher elevation that could do more damage, and subsequently abate that unit so that it doesn't happen in the years to come. And we're also looking at piloting something above 3.5 with educational and awareness material with some community partners as well. So our interventions are moving to lower levels. Here, I just want to point out again on the volume of work that's here with the oldest housing stock that we have in the state and the highly dense nature of how those homes are built next to each other. It's very frequent that we could have a home that we're at an investigation and you go to the neighboring parcel and it's within arm's reach of a child to pull lead paint out. So every lead investigation that we do ends up resulting in 2.5 additional supplemental addresses. So the volume of work is quite large, as well as the scale of the problem. And again, 2020, I think if you look down to the number of new children referred for case management, again, it's 48. The number of orders we issued that same year dropped quite a bit as well, even though that we did provide ways to get into those homes during those years. We still had the hesitation from the public that didn't want us to go there. So a lot of that we've cleaned up. In terms of the record collection that we can see with the nurse case management, we're building that into a new process going forward. So 2020 would be the area that you'd want to mark here as we're implementing electronic records for all of our property assessments, and then ARPA funding to do these at lower interventions. So on the bright side, we hope that this trend continues to get more homes abated and to reach children at younger or at earlier intervention rates. And with that, Ophelia, I'll turn it back over to you.
So I just wanted to highlight, SDC has a Let's Homes program, and I wanted to highlight percentages of assessments. So SDC completed so far 288 lead risk assessments. So these inspections use us the ability to identify the lead hazards in the home. So we assess paint, dust, and soil When we assess the water, pretty much if he has a lead lateral, we assume there is hazard present for water. We're hoping that in the near future, we are able to incorporate water remediation as we are doing the home improvement as part of the process. Right now, of the 288 homes that we assessed, 99% had positive lead paint hazards, 91% had dust hazards, and 36% had soil hazards. Next. This is just kind of like I wanted to highlight some of the common remediation solutions when we face these items. For now, SDC has funding and there is different initiatives, but this is a problem that has a solution that if we fix these homes, that we can address this hazard and we can protect the children. So I just provided a quick description of what would be some of the remediations. For example, a paint hazard, when there is a positive paint hazard in the home, we have two options. We can have a long-term fix of abatement method, whether we remove it, we replace it, we enclose it, or we encapsulate it, or we have interim controls where we stabilize and paint. When we do interim controls, the requirement is that we have to provide ongoing maintenance. And as we know, we have a lot of rental homes and a lot of those homes don't have that engagement from landlords taking care of those homes. So that results into not the best investment. So then we have the dust hazards and soil. So there is remediation recommendations for every hazard that we have when it comes to a lead hazard. Next. And just to end the presentation, I just wanted to highlight right now, SDC has an average unit cost of $40,000, and we are remediating lead hazards when it comes to paint, dust, and soil. We would add another average of like between $10,000 to $15,000 if we incorporated water remediation. With that, I would like to pass it back to Dr. David Nelson.
Thank you, Ophelia, and thank you, Michael, for that presentation, that brief yet thorough presentation on some of the issues that were being faced. You know, I was thinking as they were presenting, it would be easy for us to give up as a problem that is too large. But I applaud both STC as well as the City of Milwaukee Health Department on their tireless work and continuing to work to lower this and to educate the community and the individuals impacted by this issue. At this time, I want to bring in Maria Beltran. Maria, it's so good to see you. We always like to highlight those who have been impacted by this issue. Maria, thank you for coming on today, and thank you for being a community champion on informing the community about the hazards of lead and what may happen. Can you tell us a little bit about your story and how this became an issue within your family, please?
Yes, thank you, Dr. Nelson. Hello, everyone. I'm Maria Beltran. I'm a grandmother of two special grandchildren, Ricardo and Heraclio. I'm also a community outreach director for COLE, Let's Save Homes, Healthy Homes Project. I became involved with COLE because my grandchildren have been diagnosed as having an elevated blood levels. What tipped us off about my grandchildren's diagnosis were the behavior issues, cognitive delays, overactive behavior, academic concerns at school, are what encouraged my husband and I to have their doctor check their lead levels. We were fortunate not to have them hospitalized and very grateful for federal programs like Medicaid to cover the cost of treatment and doctor visits. We know that there are multiple avenues in which children are being poisoned, such as the water, the paint, the soil. We also know that there are ways that we can protect them. I am grateful for the Biden administration's commitment to helping protect children from child-led poisoning by investing in the bipartisan infrastructure laws, lead service lines replacement, and by investing the most amount of any other president in history of HUD's lead abatement program. I'm also happy to report that working with SDC and the state of Wisconsin Lead Safe Home program, I am able to get my I was able to get my home lead abated, but I would like to note to everyone that I still have lead-based plumbing in my basement, and I am also connected to a lead service line from the city. It is hard to say my home is fully abated with these remaining issues. As someone who has had trouble obtaining the resources necessary to abate my home and protect my grandchildren from lead exposure, I am grateful to have worked with SDC to partially abate my home, but I am one of the lucky ones. There are many people who apply for the program that are stuck on a waiting list, are denied, or simply don't know about it because the programs are deeply underfunded, sorry. That's why I really value working and being part of COLE to organize more investments into programs that protect kids, like my grandchildren, from lead poisoning. Improving our housing stock and create wealth building opportunities for Black and Brown communities through careers in the trade and business ownership. We have also launched our lead outreach program in Milwaukee's North Side to provide that door-to-door education for impacted people such as my family, and which brings me much joy to know that I can provide help to communities. I'm very pleased to be here, Dr. Nelson. Thank you for your invite.
Oh, Maria, you are just an amazing person, a force to be reckoned with, and you display love for your family, for your grandchildren, and for the community around you. I just really have one or two questions for you.
Sure.
You know, when we talked before, we talked how you felt like when you first started on this journey that you felt all alone. What would you say to other families who are dealing with this? What would you tell them to not give up hope? Because I know that you never gave up hope in this space.
I would tell them, don't give up hope. There's help. I'll help you. If I can't help you, I will find you help, and we will make things happen. It'll take time, but there's hope. It's unfortunate that our kids are the lead testers. You know, that's how we find out there's lead in a home. And just the history of being here 30 plus years, it's just, scary. Come to find out all my children were lead poisoned and myself as well. So I can imagine the other families in this community in 53205, 53206 that are deeply impacted by lead poisoning, and we need to fix this problem.
Thank you, Maria. Richard, I know that you have so many advocates on the team, and I know Maria is special in your eyes. Can you tell our audience what Maria means to COLE and her advocacy in this space?
Certainly, Dr. Nelson. Good afternoon, everybody. Richard Diaz, chairperson with the Coalition on Lead Emergency, and Maria Beltran is the definition of what it means to lead. You know, her ability to share her story and not only educate others in the community who may be in her situation, but also to work with lawmakers so that we can get policies passed that can protect more families. Last July, Maria was one parent by herself downtown at City Hall advocating for the health department to get more statutory authority to hold landlords accountable. You know, had this law been in place in the city of Milwaukee, there's a possibility that many of our families wouldn't have evictions on our records because they have landlords who don't care when their children are hospitalized by lead poisoning. So I strive to be like Maria, you know, in my personal and work life, to volunteer to save the planet and save the babies. You know, there's no way for us to adequately be able to change the world without having those who are directly impacted at the front lines of this and put in position of leadership and capacity building opportunities. much like Maria reported when she shared out, she is now a community outreach director with our Cole nonprofit, the Cole Lead Safe and Healthy Homes Project, where she and a team of canvassers are going to be doing door knocking and trying to give folks those resources and that basic education that's needed. We need to pair our ability to give service to those who need it, and also our ability to organize for policy change and funding commitments so that the work is well resourced at SDC and the health department in the state of Wisconsin.
Wow, Richard, I think Maria, that you have a growing list of people who are your admirers. So there are 2 people here, and I know that there are others as well. Jamie, I want to bring you in, and Jamie Fersinger is with the 16th Street Community Health Center. And Jamie, I want to ask you, when you hear Maria's story about feeling like not giving up hope and the impact of lead on children, what is your role at a 16th Street Community Health Center, and what do parents and grandparents like Maria mean to your organization?
Thanks, Dr. Nelson. Thanks, Richard. Thanks, Maria. I'm Jamie. So at 16th Street, our organization developed a lead outreach program 25 years ago, which is remarkable. I think, like my predecessor had like the foresight, to work along with our providers and be like, this is a real problem, because we were hearing from the parents, the grandparents, the people who are like Maria, 25 years ago, saying like, this is a real issue in our community, and we need to do something. And the providers at the clinic, really stepped up, to commit to doing a lead test on every child who came in under the age of 6. Our WIC clinic, same thing. And so to this day, we still, test every kid who comes into the clinic. And so for the last 25 years, been working really hard to reduce lead levels. And last year, we also established a prevention program because, as Maria was saying, like, her kids were, lead poisoned, her grandkids are lead poisoned. At what point do we really put all, more efforts into preventing, not waiting until we have lead poisoned children? And so we really tried to create a more comprehensive program where we have reduction and prevention, because we're hearing it from the community, we're hearing it from the providers, and it's something we all need to be dealing with. So
that idea of comprehensive is really important. I'm so glad that you brought it up and that you guys have been working on this for 25 years. Anastasia, I'm going to bring you in at a level that's similar to what Jamie's talking about, but you work with Children of Wisconsin, and you've been working deeply in this space as a project specialist around this idea of lead and clinical care. Can you talk about some of the efforts that Children's Wisconsin has done and some of the achievements that you've made that would fit with what Jamie's talking about, this comprehensive care that we need for our children?
Yeah, definitely. Thanks, Dr. Nelson. So here at Children's Wisconsin, we have been working to develop what we're calling our integrated lead program since January of last year. Since 2022, we've really been diving in and trying to take a look at not just the historical primary care space of where kiddos are coming into our primary care clinics, but also all the touch points that kids may have across our system in the emergency room, inpatient, and surgical services, et cetera, and really take a team effort across our system to be able to close lead care gaps. In order to do that, though, we've really worked hard in collaboration with the Poison Center and the Milwaukee Health Department's Childhood Lead Poisoning Prevention Program on developing a revised lead care management guideline. So our previous lead care management guideline really focused on, once we knew that a kiddo had an elevated lead, what are the next steps, especially from a medical lens of what labs need to be drawn, et cetera. But we really, through our work, took a step back, as Jamie was saying, to take a look at what are the comprehensive needs? How can we assess for the social determinants of health and really build that into our work with lead? How can we really help providers understand what are the multiple layers that we need to think about when working with children and families who are at risk for or experiencing lead toxicity. So those guidelines were recently launched, and so those are live within our system. And finally, we're also working to automate a lot of that decision making within EPIC itself. So that is taking a fair amount of work, a lot of logic on the back end that our IS colleagues are working hard on, but the goal is to be able to, again, surface those lead care gaps automatically when a kid comes into the emergency room and they need a venous lead confirmatory level. We hope to be able to do that in the near future. So thanks for the opportunity.
Thank you, Anastasia. I'll bring you back in a minute. This is going to be easy for me because I'm going to go up to another level. Brian, I got to bring you in now. When you hear about this individual story, like Maria's talking about, what Jamie said, what Anastasia said, and what Richard said, how does this help the state to think about this comprehensively? Can you speak into that, please?
Sure. Absolutely. Thank you. Brian Weaver, Lead Policy Advisor at the Division of Public Health within the Department of Health Services. One, I'd just like to commend and all the great work that's happening in Milwaukee and the leadership that's coming out of Milwaukee. So it's extremely impressive, and I learn every time I interact with this group, I learn more and more what they're doing. So this is fantastic. You know, at the state level, my primary focus has been on looking at possible policy solutions and funding solutions or strategies to support the work that's happening locally in Milwaukee and across Wisconsin as a whole. I will highlight the fact that Governor Evers has proposed his budget for the next biennium, so state fiscal years 2023 through 2025, and in there, he offers up a lot of great ideas when it comes to investments that need to be made to, one, prevent childhood lead poisoning, which people have been emphasizing here, and then responding to children who are lead poisoned. So I would encourage people to look at that and better understand what he is proposing in his budget, which does reflect a lot of the work that's happening and coming out of the Department of Health Services as well. So I'd just like to emphasize what people have been talking about. The investment in prevention is really key. And it can't be just government funding, although that hopefully will be kind of the thing that incentivizes and gets the work going. We do need the private sector to chip in as well into this effort and really provide the resources for homeowners, low income, moderate income homeowners in particular, to be able to address the lead hazards in their property and not wait for that lead poisoned child to be kind of indicating that some work needs to be done there. So we need more investment funding in giving more control back over to the homeowner to invest in their properties and improve their properties. And then also, this was brought up, I think, in a comment to the group, and I'll respond to it as well, about coordinating efforts across housing initiatives is really key and important. From my perspective, it's been a little more challenging than I had anticipated. So I do have an opportunity to talk with our other state agencies that are involved in housing, like the Department of Administration, most notably. They have a lot of funding that goes out to communities to address homelessness and also to improve older properties. And there's some challenges there. I think we've made significant progress in having an awareness and understanding that there are health issues in addition to just quality of living conditions in a home, that you need to make sure that these are linked together. So as an example, something that we kind of put front and center with those other housing initiatives is if you're going to an older property, think about remediating lead hazards at the same time as well. If you're looking for energy efficiency, replace those old windows, which is a really common source of lead exposure for small children. So coordinating resources, thinking about prevention. And lastly, Wisconsin has an opportunity to update some of our state laws as well. We are well behind some other states who are leading this work and really making a difference because their state laws allow local government to have more control over rental properties, to be able to make sure that those properties are safe for the tenants. In addition to that, having more resources for local public health departments is really key to make sure that they have the resources to respond to children and families who are lead poisoned educate families, do those resources and the work that they do, like 16th Street, in addition to health departments, to really support community members to make sure that we are responding to this issue adequately.
Thank you, Brian.
Yep.
Frank, I'm going to bring you in because I think that this is really speaks to when Brian and the others talk about this coordination and this idea of investment. You have always been a champion for the investment in the health of the community and what it might mean for the greater community. Can you speak from your perspective about what you're hearing here and how Bader Philanthropies can be part of that coordination of investment?
Dr. Nelson, thank you very much. Thanks for adding me to this awesome conversation and being in the company with these esteemed people passionate about the issue. Beta Philanthropies is 31, going on 32 years old, and we've put almost $500 million of investment into the community around many, many issues, namely the children, the elderly. But in the last few years, they've been bandying around this topic of equity, right? And we've engaged the idea of equity, which is everybody having same opportunity, we're all treated as human beings, and seeing each other as human and as equal. And if as a foundation we're doing that in the context of this conversation, there is nothing that's more inequitable than lead in the bodies of our Black and brown children. Because we have to admit that those with resources have abandoned those buildings and moved to wherever the nicer house is, the new build, the suburban. What did they leave behind? The ones we're carrying on this conversation today about equity. How do we expect them to have equal grades, elementary, middle, high school? And we as a foundation invested in all of these things, in urban education, in the youth, and making sure that they fulfill their full potential. Whenever I get to engage in a conversation around lead, it hurts my heart because it proves that we're not maximizing the investment that we make in our communities, if this could still exist. So as Brian said, we have to have the resources from all the sectors, right? From the federal, state, local, corporate sector. Our corporations are the lead on equity and diversity and inclusion. And we can't wait till they're grown up to be adults to get the nice position in the corner office when their brains are being destroyed when they're children. Just not equitable. And so as we are looking at all of this, I, as being the vice president for engagement here and the one who has to be in front of the people on the street and at their kitchen tables, we have to figure out how we bring all of the parties together with all of the resources to end this, because we can end this if we really want to end it. So
I love that phrase, bringing all the parties together. And Richard, I'm going to bring you back because when Frank mentions this idea of equity and investment, Cole is at the forefront, because not only does Frank as Frank Cumberbatch as a member of Bader Philanthropies is with the people, but you too are with the people. Talk about some of the investment that's been happening at the federal level with the President Biden's and Vice President Harris championing for this issue, particularly in Milwaukee.
Well, yeah, I feel like Milwaukee has been talked about so much in the national media because that just general coalition building and folks talking to each other that really don't talk often about things. How often do you see philanthropy in the room with the hospital systems, with the community outreach programs, with researchers, with state and local government? So I think Milwaukee definitely has the potential to be a leader in implementing some of the resources from the federal government because of our infrastructure here. Maria alluded to two very important things. One being that under the Biden administration, HUD will be receiving the most resources that it's ever received in the history of this country. And that means more money to do more lead abatement work, to fund the Lead Safe Homes Project and help resource health departments. I think the infrastructure that we built from ARPA in the health department, working with community-based nonprofits like Revitalize Milwaukee or Habitat for Humanity, but most importantly, SDC has been a leader. Tyler, the current interim health commissioner, has been out in DC sharing the big news. I think also the work being done by Employ Milwaukee around workforce development and working with, I'm going to be saying this acronym a lot, but SDC, their ability to utilize that absolute advantage program to train folks for 12 weeks and work with contractors to get those folks on board and, partially subsidize their wages for the first few months. It's only models like that where these different entities are talking to each other that will really make true to the president's commitment of Justice 40, where 40% of all federal investments go into neighborhoods and communities that are defined as disadvantaged communities. So there's much potential in the city of Milwaukee to continue moving and working with these different levels and layers of government to save more lives and be there for more children. I would like to share also some of the more local work that's being done. So, modeled after the Let's Say Cleveland Coalition and, the tremendous work they're doing in Cleveland, Ohio, to bring together that relationship of philanthropy, the private sector and the public sector, dedicating money annually to focus areas as it has to do with lead. So for instance, workforce development, contractor development, community outreach and engagement. We've waited too long to invest in our lead and our lead infrastructure and our ability to respond to lead poisoning cases. We're already in 2023 and we still got to wait for a kid to get poisoned in order for the majority of our response. So, modeling what Cleveland has done and creating the Milwaukee version, what Cole has termed the Lead Safe and Healthy Homes Fund, where we can organize different partners to dedicate annually to this fund so that we don't have to wait for children to get poisoned in order for us to act.
Dr. Nelson, if I could add just real quick,
Sure.
a couple more points to what Richard just said to show again where I'm really proud of, again, when Milwaukee is moving the needle, even though, I'm a little bit impatient to see how I want that needle to move a whole lot faster, but I will still give him credit. I have to add that on top of all of his examples is the CDA, the Community Development Authority formed by the Zilber Foundation, the Greater Milwaukee Foundation, and Beta Philanthropies and others in the community to call for 32,000 new units of housing, is to shift and housing for those people making under $20 an hour. That's a major shift if we can shift those families from those lead homes to new homes where people, again, that equity of giving people that quality of life they deserve as human beings, right, is again a great strides made. Could be it's on the periphery of lead, but it has a direct impact by taking the families out of those homes and moving them into homes they can afford, but a modern structure.
Thank you for that. Ophelia, I got to bring you back because you're getting a lot of support for the work that SDC does. And I know that you have many examples from the work that you do. I always like to talk about, we want to talk about the challenges that we're facing, but can you give us a success story that you really can pull out to say, this is how this is, and this is how it could work. And imagine if we scale this to a level where we're having this engagement that we're talking about at a very large level. Can you give us an example from your work, please?
Absolutely. And thank you everyone for highlighting the hard work. I can't take the credit without everyone supported. This is definitely, I think one thing that we're learning is we're learning how to work with each other, right? This is the magnitude of the problem that we have in the state of Milwaukee and in Wisconsin can be overwhelming. And I think this group has learned to break it into pieces and then truly see the big picture. I think, when we touch a home, and I'm going to use Maria, I had the opportunity to work with Maria, the timeline that it takes for a program to be developed. The Let's Save Homes program funded through Medicaid was the first program that was committed to make sure that we do lead abatement, that we do that 20+ year fix in a home. We don't want to patch, right? You don't want to put a Band-Aid, because once you remove the Band-Aid, we go back to the same problem. We want to remove and replace windows. We want to enclose the exterior with aluminum so then we can make it dust tight and we're not having to do ongoing maintenance every so often. It makes sense to make this home investment, and I'm going to just highlight a few things why. One is we should not be using our children to be the indicator that we have a problem in a home. Right now, unfortunately, the state of Milwaukee doesn't have a proactive system to be proactive in assessing these homes before a family moves into this home. We are waiting for a child to be tested or for the city to receive a complaint to be able to follow up on the home and just kind of find out what's going on. So when we have these community problems, the volume is significant, but we have to break it into realistic pieces. We have to make sure that the resources that we allocate right now is gonna protect future generations. And so when I had the opportunity to work with Maria, she applied for the program. Anytime we receive funding, you have to make sure we are in compliance with the requirements. But then, that trigger for us to not only assess the home, identify the hazards, make the home lead safe. We are providing a quality home that they can be free to open their windows during the summer, not having to worry about, touching lead paint or touching dust and then putting it in their mouth. Be able to play outside without worries. So there is a lot of good benefits. But then, we are able to empower our local economy by hiring local contractors. We have enough contractors around us that we can empower them, teach them how to properly follow, let's say, work practices and fix these homes. In the last 2 years that I've been working with doing lead renovation, we recruited more than 12 contractors. These are minority contractors, the small businesses, but then also that gave us the opportunity to increase the capacity of the Absolute Advantage program to recruit local residents to go through a basic construction program, get them on board so that they can get employed to do the home renovation. So I think, there is all these pieces coming together is definitely a lot of hard work. I would say I've been doing this. I'm going to my 3 years coming back to SDC and running the Let's Save Homes program. And I'm finally seeing the light, finally seeing pieces coming together. My biggest reward, and I'm sure it's all of us, is coming down, 10 years from now, celebrating the success, going from 2,000 kids being lead poisoned every year down to like maybe 5. It would be ideal that we can bring it down to 0, but it is impossible because actually I was learning as I connect with different partners across the state. We had to, we actually have we had a lot of manufacturer companies, and we were big on lead. So that makes sense why the city of Milwaukee has thousands and thousands of homes. When we compare the issue across Green Bay, they had a few hundreds. So they, as soon as they discovered the issue, they were able to jump on it and start fixing it right away. For us, I think we need a more aggressive approach to address this issue. And I think we have the right people, the right motivation, and we have the heart because we want to protect our children.
Thank you for that, Ophelia. I'm going to do a little rapid fire here, and I'm going to start with you, Michael. Michael, what gives you hope in this area, and what do you see for the future? Give us a what you see.
Well, I think the collaboration that's happening now hasn't happened in a very, very long time. And so we kind of know that we have this pot of money from the federal and state grants that we get, but that's nowhere near enough to handle the epidemic that we have in terms of the number of units and the cost associated with each one of those units, which could be in excess of $40,000. So we've got that, but we know that there is money there. There is money there, and a lot of it is in the private sector. And so kind of talking about the regulatory reforms that we can do with Brian and opening up those discussions about how we can hold the relevant people responsible, because they're all breaking laws. And to really get the rental industry and that regulatory reform done is a huge help to us, and enforcement strategies to really bring the bad guys, the worst of the bad guys, in and have them, pay for what they're doing wrong. Some of that regulatory reform can also include some of what Richard's been talking about, a rental inspection program, which we really need to have in this city, to be able to go out and do those inspections and kind of, to a little bit of Ophelia's point, not have the kid be the detector. Get out there proactively, start doing our interventions at earlier levels than waiting till 15. I mean, 3.5 ought to be our intervention level, but it encompasses a lot of funding. So, we can take the federal, we can take the private, but we've got to start thinking about that fiscal cliff of ARPA. Once it's gone, it was a one-time deal. So we need to start replenishing it with money from philanthropies, money from hospital systems. How can they all work together in the case management side of it? And I think a lot of it inevitably will come back down to how can we maintain properties that we have abated? How can we warn the public to not go into those properties? How can we notify them in advance that this might not be a good home to rent out? So a lot of that regulatory reform, I know we're talking about it. I'm optimistic because this week I'm proud to share that we reached out to HUD, and HUD has tentatively agreed and approved of us to have a housing compliance officer to assist in some of these, to move some of these cases. Instead of just giving money to landlords that poison kids, let's take them to court and really dedicate the personnel to that end of it and kind of free up the taxpayers to really use the money towards low-income homeowners.
Thank you, Michael. Jamie, what gives you hope in this area from a healthcare perspective?
I would echo Michael in a number of ways. I think that we're at an important and exciting time right now. I feel like we're at an inflection point where the medical, sector realizes there's a problem, but so does everybody else. And there's a lot of intention and energy around addressing the issue of lead poisoning right now at this time. And I feel like this is a true example of Milwaukee addressing an issue through collective impact. And, I think we all are realizing that we're better together, we're stronger together, and also in partnership with residents. And I think more than almost any other issue I've seen in the past, we are bringing residents to the table. We're asking them, what are the needs? How do we help? And so I just feel like this is just a really beautiful example of collective impact around an issue that's just such a complicated issue. And but we're stronger together, and I think we're looking at positive solutions together. And it took us a while to get here, but we're moving forward on it. So that gives me hope.
Great. Anastasia, same question. What gives you hope in this area?
Gosh, I need to echo basically exactly what was Jamie was saying. I think what gives me hope is this room and all of the participants being here and this conversation, and that these conversations are continuing. I know this is going to keep, the momentum is here, and we have many different people here on board in the room and ready to not only take ownership for their own role, but also say, hey, how can I help? How can we reach out? How can we connect and continue to move forward? So exciting.
Right on. Brian, what gives the state hope in this area?
Well, I'm gonna because we're talking about right now healthcare. I was on a call recently with the chief medical officers of all the Medicaid plans in Wisconsin, and it was on the issue of blood lead testing. I was pleasantly surprised that every one of them understood the issue enough that they knew what was going on in their among their providers, in their plans, about things that they're trying to strategize and do to improve blood lead testing. So I agree. I feel like there's a bit of a shift and more of an appreciation, understanding that this is a critical public health issue that healthcare providers, and particularly Medicaid providers, need to play an active role in, a leadership role in. So that's what gives me hope. It didn't stop there. We're going to continue to meet with them, and I'm optimistic that they're going to step up and lead where they need to lead.
Thank you. Frank, what does it mean to make this shift as we're talking about, to actualize it over the next decade?
Well, I think it started. I've been in Milwaukee now for 45 years, and I have never seen this city more collaborative than it is today, and that gives me great hope. Maria Beltran gives me hope. We need a million Maria Beltrans, right? To fight for your children, fight for your grandchildren. And thirdly, the idea of and plans and strategies around new housing. No mother, regardless of how poor she may be, wakes up in the morning saying, I can't wait to raise my child in this filthy, lead-infested house. Not a single one. But what we need is more than that she can afford, more choices, so she can go towards where the children needs to be. So I see all of these parts coming together. Like you can see in my theme, I'm very impatient about it, but I'm hopeful because I've never seen it more aligned than it is today. It has to be even more aligned, but the light at the end of this tunnel is getting brighter and larger. And I think we're getting it.
Richard, do some piling on, man. Let's go.
Yeah. You know, what gives me hope and optimism is to see that we were able to produce a turnout of about 50 people here today that would take their afternoon to listen in. And you know, I got to give a special shout out to my colleagues that I see in the waiting room, in the listening room, Sally Callan, Terry Wiggins, Rhonda Nordstrom, Lena Lay, you know, all these wonderful, just terrific folks who work in coalition with us to move the needle forward on this. I also, you know, have to give great praise to Governor Tony Evers and his ability to, you know, explore concepts that, you know, if we had a little bit more support within our state to help explore these ideas, we would save so much money. You know, every dollar invested in lead remediation or response to a lead poisoned child has as low as a $17 return on investment. I've heard anywhere up to $203 in our return on investment. So, you know, to keep moving forward, to keep moving in coalition, you know, establishing this public-private partnership that is so needed. You know, the public sector is exhausted and needs support. And not only from philanthropy, not only from hospitals, you know, that's just a small speck and a drop in the bucket. We need corporations, we need banks, to give up some of that wealth and reinvest it right back into the community. I'm very optimistic for what Medical College of Wisconsin is doing, and your leadership and work, Dr. Nelson, to explore, what do community and clinical solutions working together look like for lead poisoned children. So thanks again.
Well, I want to end with this conversation with highlighting Maria. If we could highlight Maria one more time. Maria, I want you to send us off with a thought.
Thank you. I just want to say thank you to Frank for those kind words. And he said, we need a lot of me's. We need a lot of yous, because you are the ones that make it possible. Thank you to Richard for believing in me. Thank you to Jamie for allowing me to be trained. Thank you, Ophelia, for making SDC possible, and to Brian with the state, and Michael and all of you guys. Just, we need a lot of more of you guys, and I have faith. So I'm going to leave it with that.
And you know what? And we'll leave it at that. I want to thank our panel for joining us. I want to thank all the listeners and all for the people who viewed this webinar today. I am David Nelson, and this has been our webinar on getting a lead-free Milwaukee. Thank you and good afternoon.